There's kind of a theme running through this that there's a lot of resources in the area, but not everybody knows where they are. They're not connected. I'd kind of like to hear from some of the folks who haven't made comments yet, but how do you see this group, for example, addressing that issue? What do you think is needed for us to come together and do what the talk leader here said is needed to do, and that's really move towards bringing people together and building that trust issue? Anybody have any comments?
Well, I have comments, but I've already spoken. More comments. I have several different comments. I think what's needed to what you just said is that you need at least a few individuals that are devoted, committed to the process, and that's the main thing. You can't just continue to bring everybody together. At least that's been my experience in other community organizing venues. And in my small community in Hollywood, we have done a lot of cobbling together of what we term loosely community case management, because there are a lot of us in the community that were brought together for different reasons that found that there were no resources for people we were dealing with. Somebody, from a church, somebody from the business improvement district security, somebody from the law enforcement, somebody from homeless services. So because we saw that we had a common need, and I deal with homeless people, so you're hard pressed to find somebody who's homeless who's not depressed, so pretty much that's, a given of what we deal with. But all the other resources, like I love what this gentleman was saying at Palmdale Mental Health about the things they have available for people to just engage them. Unfortunately, the things I know about in my community mental health resources are not accessible. People have to meet specific criteria, and most of the people that I'm dealing with don't meet that criteria. So it's an access issue. I'd love it to not be stigmatized like that. If there were open and available recreational community resources that people felt, that anybody could go to, that, was comfortable. As it is, what we do is we refer, I'll call up the pastor at one of my churches or another community organization I know and just talk to them about the client that I'm really concerned about, or my case managers will do that, and just say, do you know of a support group that might fit, this person? But it's not a strategic sort of process, is what I'm saying. We're kind of still operating in that crisis mode. So, what's that?
How many of you here are actually involved in some sort of coalition, partnership, collaboration? How is that working? And what can be done to improve what you're involved with right now?
It's almost impossible nowadays to work without being involved in coalitions and collaborations. It's just, nobody can exist in a silo anymore. And going back to some of the previous comments, we've been finding that neighborhood-based really works well. It's hard to ask people, even when the resources are there, and the resources are there many of the times. It's really hard to ask people to go out of their neighborhoods, to travel, particularly when they're depressed. It's better, we have found it better to bring the services where they are, in non-threatening environments, whether it's in their home or community centers or parks, etc. So basically, neighborhood-based collaboratives have worked better for us.
I agree with that. And let me just ask one more question then. How do you see, or do you see, the possibility of connecting those neighborhood-based coalitions? Make a larger group? Is that possible?
Well, I'll give you an example from the nurses. So I have a group of 20 nurses. We work in over 60 churches, community organizations, and we try to cross-pollinate. So we've created a network. We've been in the community for 15 years, and so we have kind of an established trust base. So that's a good thing. But what we try to do is cross-pollinate, where we bring everybody together and get them to learn from each other. So we have some outstanding volunteers that go from church to church to talk about developing a health outreach program. So they don't hear it from me, they don't hear it from the nurse, they hear it from a community representative. So trying to do that cross-pollination and spreading the word in a way that you can hear it. So a lot of community members maybe couldn't hear it from me. They might not be able to hear it from my nurses or staff, but they can hear it from another church member.
Okay, we're kind of running out of time here. Any comments about how you might see this group doing some of these things? In the course of the discussion that we've had today, you see that this group has the possibility of doing some of these things that might improve the system.
Over here.
Yeah, I do. I think one of the things that's important too is it's a support system for us. Because I know a lot of times, if I'm in like a West Side homeless partnership, and just being able to talk to other people who are seeing the same things that I'm seeing is a way for me to sort of feel better about it. That I'm not the only one seeing the craziness that's going out on the streets, the people that are experiencing mostly homelessness is what I'm used to working with. But I often come out of meetings with the partnership, maybe I've learned something from other agencies, but it's also just, I feel better that there are other people out there dealing with the same issues that I'm dealing with, and that I don't feel like I'm alone out there. And I think that this is a great place for that type of thing too.
So then to amplify your point, when you have those kind of discussions, what priorities emerge from that? Or what priorities emerge in your minds, anyone here today, when you hear these things? What comes out to be, in your mind, the things you should focus on?
I guess we learn from each other just to try to help that client that is in distress, that we're not able to refer them to a facility to receive this treatment. And we're more educated to help them at least at that point of time. Or, unless it's really drastic, because it's like we're in the San Gabriel Valley. If the person in us is not bipolar or schizophrenic, we cannot refer him to the mental health, because he needs to be like all the way completely out of their mind, or else, there's nothing in between. So I think by learning from other people, we have that education and learning from others, and then take whatever they're using, and then, maybe that will help my client, and then we could just approach and teach that client to help themselves.
So then a priority is your own self-education in order to increase your own strengths, your own knowledge.